Hello, I'm Ibrahim Imam, and welcome to another episode of the Neurology Lounge podcast. This one is titled 10 Major Non-Motor Features of Parkinson's Disease. Since its first description by James Parkinson in his seminal paper titled An Essay on the Shaking Palsy, published in 1817, the clinical phase of Parkinson's disease has been defined by its motor features. It is drummed into the brain of every medical student that the cardinal features of the disease are rigidity, slowness of movements or bradykinesia, resting tremor, and postural instability. And so, for centuries, this became the dominant features when assessing and managing people with Parkinson's disease. It is therefore only relatively recently that the non-motor features of Parkinson's disease got any attention whatsoever from neurologists, even though their patients have been telling them about non-motor symptoms for ages. Here then is a countdown of the 10 major non-motor features of Parkinson's disease we need to pay attention to. Number 10, dermatological or skin abnormalities. Some of the non-motor features of Parkinson's disease do not need much effort to elicit, as they are evident by simply observing the skin. And the range of disorders here include seborrheic dermatitis, excessive or reduced sweating, rosacea perioral dermatitis, which is inflammation around the mouth, and bullous pemphigoid. Some skin lesions in Parkinson's disease are, however, a result of the treatment they are on. For example, apomorphine can cause skin nodules, levodopa can cause subcutaneous nodules and pigmentation of previously white hair, and amantadine can cause livedo reticularis. Number 9, neuromuscular disturbances. Parkinson's disease can manifest with large or small fiber neuropathy. Risk factors for these include the severity of Parkinson's disease, being on treatment with levodopa, and the presence of vitamin B12 deficiency. Parkinson's disease may also manifest with myopathy and muscle weakness, presenting as head drop and spinal deviation, something called camptocormia. Number 8, autonomic dysfunction. Disruption of the autonomic nervous system in Parkinson's disease manifests in almost all the organs of the body. In this way, it can cause excessively low blood pressure, excessive urination, especially at night, constipation, difficulty swallowing, erectile dysfunction, drenching sweats, excessive salivation or sialorrhea, and running nose called rhinorrhea, the so-called runny nose sign. Other symptoms of autonomic impairment in Parkinson's disease include heat intolerance, fatigue, and spontaneous periodic hypothermia, which is a reduction in the body temperature. Number 7, eye features. The eyes are frequently a source of symptoms in people with Parkinson's disease, and the typical complaints are dryness, itching, pain, excessive tearing, blurred vision, and light sensitivity, also called photophobia. There's also eye fatigue with dimming vision and headache, something called asthenopia. Number 6, hallucinations. Visual hallucinations occur in 75% of people with Parkinson's disease during their disease course, and there are 3 main types. The first are vivid visual perceptions of people, animals, buildings, and sceneries. The second, misrepresentation of normal objects. And the third, called passage hallucinations, which appear in the peripheral visual fields. The hallucinations tend to occur in specific places, especially at home, and they are more frequent in the evenings or at night. The objects of the hallucinations are usually non-threatening, and they may just last a few seconds or minutes and then disappear. Luckily, people affected with hallucinations in Parkinson's disease have a very good insight that what they are experiencing are not real. Beyond the visual, hallucinations in Parkinson's disease may also be auditory with hearing, gustatory with taste, olfactory with smell, and tactile with touch. Number 5, psychiatric features. The diversity of psychiatric symptoms that manifest in Parkinson's disease is, to say the least, surprising. At the simple end are anxiety, depression, apathy, anhedonia, which is lack of interest in pleasurable activities, and alexithymia, or difficulty identifying and describing feelings. And at the complex end are delusional jealousy, obsessive compulsive disorder, demoralization, the inability to cope, and the feeling of presence. This is a false but vivid sensation that somebody else is nearby. A third of people with Parkinson's disease may also present with features of functional neurological disorder called PD-FND. Number 4, sleep-related disorders. Sleep is disrupted in people with Parkinson's disease partly because of associated motor symptoms such as dyskinesia, abnormal movements, and tremor, and partly because of the side effects of the medications they take. But beyond these, Parkinson's disease on its own is a cause of some specific sleep-related disorders. And top of the list here is REM sleep behavior disorder, in which people tend to act out their dreams. For some reason, REM sleep behavior disorder is more common in people who do not have prominent tremor. People with Parkinson's disease are also bedeviled by excessive daytime sleepiness, which is present in 50% of cases, and this is an early non-motor symptom of the disease to watch out for. Other sleep-related problems in Parkinson's disease are periodically movements of sleep, insomnia, vivid dreams, and nightmares. Number 3, cognitive impairment. The range of cognitive impairments seen in Parkinson's disease range from mild cognitive impairment to dementia. Curiously, cognitive function is reportedly worse when the subject is lying supine on the back. Number 2, pain. Pain is so common in Parkinson's disease that it is reported in more than 80% of people in the early stages of the disease. 7 types of Parkinson's disease-related pain have been described, and these are Parkinsonian central pain, or PCP, fluctuation-related pain due to wearing off of the effect of medications, dyskinetic pain from excessive abnormal movements, off-period generalized pain, off-period dystonia-related pain, and Parkinson's disease-related chronic pain. And that is not all. There's an even longer list of non-Parkinson's disease-related pain which range from musculoskeletal, orofacial, limb and visceral pain to genital, dystonic, temporomandibular and bruxism-related pain. Number 1, impaired sense of smell. Also known as hyposmia, impairment of the sense of smell occurs in up to 90% of people with Parkinson's disease. And indeed, it may emerge years before any of the motor symptoms of the disease appear. And perhaps expectedly, it is worse in males than females. It typically involves both sides of the nose, and only rarely is it the total loss of olfaction, called anosmia. Curiously, its severity may correlate with impaired cognitive and cardiac sympathetic function. Thank you very much for watching or listening to this podcast. If you enjoyed it, why not click on the like button? And even better, why not subscribe to the YouTube or Spotify channels so that you don't miss the next episode of the podcast. And whilst waiting for that, why not check out my book, Surfing the Brain, and explore my website called Neuro Checklist. In the meantime, thank you very much for your time.